Primary healthcare centers across Nigeria has been characterized by infrastructural decay, loss of health inventory, unavailable medical equipment, poor staffing, and working conditions. In most PHCs, vaccines are either unavailable or cannot be properly stored. A reason why the Senate is calling for an investigation into the activities of NHIS to enable necessary actions are taken to improve the services of the schemes for the attainment of a universal health coverage for Nigerians.
The Senate is worried that failure of primary health care and belief that it is for low-income earners has led to an influx of patients to the secondary and tertiary health care facilities. The Senate is further worried that our secondary and tertiary healthcare facilities are burdened with treating common ailments that could have been handled at a primary healthcare center. Concerned that the average Nigerian is one illness or tragedy away from poverty.
Lawmakers in their contributions called for free healthcare services across the country, while their KB Central counterparts, Adamu Aleru, noted that Northeast and Northwest are the most hit.
Mr. President, the essence of government, or any good government, is simply to save the lives of the numerous poor masses while protecting the interests of the few. But this doesn't seem to be the case in our country, as we have very poor masses and citizens of this country who are languishing in our rural areas for lack of adequate medical care.
This is the most potent. Primary health care is the most potent way of creating access to the poorest of the poor in the area of health delivery services that will be affordable and efficient. I've listened to some of my colleagues here. Ordinarily, and rightfully so, primary health care should be with the local government. And of course, state will handle maybe the secondary care and the tertiary, just as the distinguished Senator, I think Aleru said, with the federal government. But the reality is that even the local government, they do not have enough even fund to pay for their even primary school teachers. Not to talk about even the local government staff themselves, before we begin to talk about creating maybe primary health care centers. That is the reality. So clearly, anything that will bring about increased funding for our primary care centers is a welcome development.
As said by my colleague, Nigeria is rated as one of the poorest countries in the world. And as far as healthcare is concerned, Mr. President, the true situation is that the Northwest and the Northeast are the poorest. This is why we have the highest number of infant mortality. This is where we have the highest number of mothers dying during birth, maternal mortality. It's time for us to do something.
In spite of regular budget releases, the NHIS has fallen short of attaining its objectives, a reason why the new NHIS boss is given more time to get acquainted with the office before a committee is set up to investigate the issues.
The Chief Executive Officer a bit of time to sit down and resolve some of the issues in the agency before we maybe set up an ad hoc committee to go investigating. It is okay for the motion to come this way, and then we can pass the information to the new chief executive, so that he's very much aware of the concerns of the Senate, and then we give him a bit of time to settle on the job before we make any further move to investigate the agency. Because for almost 3 years, the agency has been in a comatose state. And it is even so bad because at a point, when the crisis was going on between the Minister of Finance, Minister of Health, and the Executive Secretary of NHIS, it got the staff even got divided into two camps. So the new Chief Executive has an enormous task to get his agency together, put his workforce together, get the HMOs quickly reaccredited, pay off outstanding debts, because the fact that the HMOs have not been reaccredited and paid has actually strangulated most of the tertiary institutions, the teaching hospitals in Nigeria, because most of the civil servants that are treated by the teaching hospitals are paid by the HMOs. And it has really affected the health sector a lot. So my only concern here is we need to give the Chief Executive a little bit of time to get to resolve some of the very urgent issues in this motion before maybe we go visiting or go to, investigating the agency. Thank you very much, Mr. President.
Thank you very much, Senator Bashiru Ajibola.
President of the Senate in his ruling said all the resolutions should be taken into consideration.
Those in favor of the additional prayer by Senator Ayo Akinye-Lure say aye. Those against say nay. The ayes have it. Very distinguished colleagues, thank you very much for the various interventions. And NHIS is a very important institution in the health sector of our country. I believe that when our Committee on Health will be reconstituted, it will have its hands full. I happen to chair another committee on NHIS in the last Senate, and I know the kind of issues that are within that institution. We believe that we should have more coverage, and I agree completely with the position of Senator Lawrence, of the need to capture those who are outside of the formal sector, because maybe those who are in the formal may not be more than 5% of the population. So we need to have the coverage widened and deepened.
The Senate also ordered the NHIS to direct all health maintenance organizations to within 2 weeks settle all outstanding debt owed to all healthcare providers in the country. Sandra Guana, TVN News.